Malechi. I'm a consultant obstetrician gynecologist. I'm a lecturer with the University for Development Studies School of Medicine and also the Tamale Teaching Hospital. I am a key advocate when it comes to cervical cancer, and this month happens to be the Cervical Cancer Awareness Month. Well, cervical cancer affects women. Annually, we lose about 2,000 women to cervical cancer each year. And the issue of cervical cancer is a very dire one for us in Ghana because we do not have a well-structured screening program across the country. Cervical cancer is known to be a preventive cancer. About 90% of cervical cancer is caused by a virus that is known, the human papilloma virus. And there is a lot one can do so that you do not get the human papilloma virus. Or even if you get it, you do not end up in cervical cancer. Talk about cervical cancer. Like I said earlier, it is one of the leading causes of cancers worldwide. Elsewhere, a lot of work has been done on cervical cancer such that it is no longer makes it up to the first 10. But it has now remained as a cancer of low-income countries like Ghana. So most of cervical cancer, about 85% of cervical cancer, occurs in sub-Saharan African countries, and Ghana is part of this. In Ghana, we record as many as over 1,700 mortalities from cervical cancer each year. And if you go to most of the leading hospitals and you check in our data on cancers, you will find that if you take out breast cancer, cervical cancer is the next cancer that affects women. Well, in other places, when it comes to awareness creation, it has been structured into the healthcare program, such that women are reminded by their general practitioners at the time they reach the age for screening and each time they are due for screening. So women are aware and then they go for screening. And for that reason, people have this information. Elsewhere, as in developed countries, they have structured the immunization program into their healthcare for the young people. So before the person becomes even sexually active, they know that the jab they took when they were this year, 12 years, 40 years, was for cervical cancer, and for that reason they are aware. Here, we do not have a structured program. So, and then even when it comes to our campaigns, they are very sporadic. So we have this Cervical Cancer Awareness Month that a lot of agencies are trying to help us do the campaign. But then after January, the energy dies down until the next January. So that is why the information is not well spread out as we expect it to be. So, as I said, cervical cancer is caused by a virus. We know that the human papilloma virus is responsible for about 95% of cervical cancers. And the human papilloma virus is a sexually transmitted virus. So we wouldn't be wrong if we say that cervical cancer, in quotes, is sexually transmitted, because you would get cervical cancer from the human papilloma virus, and that is sexually transmitted. So things that we will do against getting the human papilloma virus are the things that will prevent us from getting cervical cancer. So with the background knowledge that human papilloma virus is almost solely responsible for cervical cancer and is sexually transmitted, it just makes it clear what the risk factors are. So any woman who has a high rate sexual exposure, that is, you have multiple sexual partners, or you have a sexual partner who also has multiple sexual partners. So you would have one sexual partner, but your sexual partner has other sexual partners, then you are at risk. If you have sex very early, if you start your sexual debut very early in life, when you are very young, the mouth of the womb that we call the cervix is not very mature, and you can easily be affected by this virus. So early sexual debut is one of the risk factors. And if you have any other sexually transmitted infection, it makes the whole area inflamed, and you can easily contract the HPV virus. If you have